Welcome, everyone. I'm so excited that you're able to join me in this power packed webinar to discuss the topic of functional medicine, what it is, how it works, and how it can be so essential to your overall health. In my practice, so many times I hear the question, what is functional medicine? It is such a broad term, and people really don't understand. I mean, they'll understand the word medicine because they've been seeing a medical practitioner for a long time. Maybe that's where you're at too, and you just want to know a little bit more about what functional medicine is and how it can help you. Um, you know, the reason I practice functional medicine, the reason I am a chiropractor, is because of this picture right here. This is a picture of my family. I do everything that I can in my power to help us in our quest for optimal health and so that we can enjoy each other. And that's what I really desire for you, is that you're able to enjoy the people around you, enjoy your loved one, enjoy your family, your friends, and be able to do the things you love with them. So that's what we're going to do tonight. We're going to discuss how functional medicine can actually benefit you. But first, we have to understand what the differences of functional medicine are. So, there is the term functional medicine and there is also conventional medicine. And so most people are more likely to understand what conventional medicine is because most people go to their primary care physician. They get blood work from their primary care physician. And that's really what we're talking about when we talk about conventional medicine. But we do need to understand what conventional medicine is before we contrast um, what's going on between the two and how they differ. All right, so let's talk about conventional medicine a little bit. We're the National Institute of Health defines conventional medicine as a system in which medical doctors and other healthcare professionals treat symptoms and diseases using, things like drugs, radiation, surgery. But we also have to understand what are the similarities between conventional and functional medicine, because I think this is where people get lost a lot of time. And one, they're both practiced by licensed medical professionals. They both are evidence based in and among themselves, and both utilize diagnostic testing and diagnostic testing such as blood testing, X-rays, MRIs, CAT scans, things like that. And both use those. Conventional medicine is extremely effective for treating acute problems such as heart attacks, broken bones, and any kind of physical trauma that we're going through. And while conventional medicine is a good tool for many things, functional medicine is really built on the technological advances made in conventional medicine. So the approach to chronic conditions is where conventional and functional medicine really begin to differ. And so let's take a look at that for a minute. All right, so unlike conventional medicine, functional medicine really focuses on identifying and addressing the root cause of the disease, not just the symptom. Functional medicine examines every factor involved, including the symptoms, the genes, the environment, lifestyle factors, and not just treating the symptoms, right? There is a statement in functional medicine where conventional medicine is really treating the disease, and functional medicine is treating the person that has the disease. So we really need to get deeper to understand exactly what's going on with the person's body. But functional medicine was developed based on the understanding of the importance of an individualized approach to disease based on the evolving research in nutritional science, genomics, epigenetics, and that's according to the Institute for Functional Medicine. At the heart of functional medicine lies the understanding that when the underlying causes are not addressed, problems can progress and worsen. So, lifestyle factors such as diet and stress often are the are consequently lead to irritating, chronic, and painful medical conditions. The body is well equipped to heal itself. However, a poor diet and excessive external stressors can interfere with the body's ability to heal naturally. So, the following factors are what truly set functional medicine apart from conventional medicine. And this is really, it focuses on the cause of the symptom, right? It is a holistic view of the entire body rather than a collection of separate systems. It examines the body, mind, and spirit connections to determine both physical and emotional aspects of the disease. It improves the body's innate healing ability, the ability to heal itself, and it partners with patients, allowing both parties to actively participate in treatment. Rather than just one part of the healthcare system working. It's both people working. It's the practitioner and the patient being able to function together to produce the effects that they want. Now, why we prefer the functional medicine approach? Well, what we've just discussed, the goal of functional medicine is to determine the root cause of an illness or disease in order to treat the cause of the symptoms. Now, functional medicine uses the symptoms as a clue to discover something hidden deeper. Now, picture a tall oak tree. And imagine what we see above the ground as the symptoms of disease. The extensive root system below the ground is less visible, but not less important. The roots symbolize the cause of disease, and functional medicine takes into account both the seen, which is the tree above the ground, and the unseen systems of the body in order to understand how everything works together. Now, when it comes to a chronic condition, a systems-based approach is needed. But this can be a time-consuming process, which is why functional medicine is the preferred approach by a growing number of medical practitioners. So we have to go through the basic principles of functional medicine and why it is what it is. And, it's a personalized healthcare treatment to treat individuals, not diseases. As each of us are genetically and biochemically unique, functional medicine supports the body's natural ability to heal rather than tackling disease directly, right? So since we're all different, is that one, statin drug for cholesterol going to work for everybody? No, it's not. Because everybody is different, like we just said, biochemically different. So it's going to take different things for different people, and everybody's going to react differently. Research shows that disease and illness is composed of really a complicated network among various systems in the body. So functional medicine utilizes this science, to understand the relationship among these functions and to help the body self-regulate and heal. So we're really tapping into this natural ability, and it helps promote natural healing and even prevention of many diseases. Did you actually know that health is defined by the World Health Organization as a state of complete physical, mental, and social well-being, and not merely the absence of disease, right? So, what that means is, if anybody's ever heard of the triad of health. So if you were to make a triangle and you put at each tip of the triangle, you put physical, mental at another end, and then you put social well-being, which can be emotional, it could be biochemical, it could be a lot of different things. But if that triangle, if one thing is missing, you don't have a triangle, right? At all. One side of the triangle is gone, and then now you just have two lines. Well, what that means in effect is that if one side is missing, if you're not healthy on one side of that, it's going to cause problems for the other areas. And so really what we want to do as functional medicine practitioners is really to complete the physical, mental, and social well-being together and do it all at once. So what kind of conditions are we talking about? So functional medicine has been proven to help really a wide range of conditions, and a lot of these are including like cardiometabolic conditions. If you don't know what that is, those are things like diabetes, high blood pressure, heart disease. There's also neurological and psychiatric conditions, right? So we're talking about nerve, brain, mental issues like depression, attention deficit disorder, and migraine headaches. There's a ton of people that have migraine headaches out there, and a lot of that can be taken care of. Digestive disorders, IBS or irritable bowel syndrome, ulcers, pancreatitis, or chronic pancreatitis, acid reflux, diverticulitis. If any of these sound familiar, I mean, there's 80% of the world has one of these things. Autoimmune diseases such as rheumatoid arthritis, lupus, celiac disease, skin disorders like psoriasis or acne or eczema, and then a huge one, and this is really where most of my specialization comes in, is the hormonal problems like thyroid conditions. We're talking about probably 65% of the population has a thyroid issue and they don't even know it. Chronic fatigue, menopause. I mean, this is just an example of some of the conditions in which functional medicine can help with. But those are the main ones. And so, let's talk about now just like a personalized plan. Like, what is the goal of functional medicine? What are we looking to do? Well, we're actually looking to repair and restore the body's natural ability to heal by restoring system balance. So that means getting all the systems working together. And since each of us is different, care plans are unique, right? Care plans can include a variety of different things, such as lifestyle changes and diet. Like that, lifestyle changes can be diet, exercise, stress management tools, right? Because stress can do so much to our bodies in a negative way. Detoxification programs, nutritional supplements, botanical remedies, right? And then prescription medications. Now, prescription medications would generally be more along the lines of, something that really needs a medication to keep it under control. And if we're talking about diabetes, like type 1 diabetes, where you're just unable to, really make insulin, you have to have insulin. So you have to be able to inject yourself with insulin at that point. But most diseases don't need prescription medications. Most problems don't. There's other ways to actually take care of it. So each plan developed between a patient and the practitioner, it really aims to restore the imbalances that are really causing that specific condition. Or we look to prevent chronic conditions from occurring in the first place. So through functional medicine, we can kind of see patterns that can lead to certain types of diseases, and so we can prevent those from actually happening through what we've been talking about. So, an ounce of prevention is worth a pound of cure, right? I mean, if you really think about that, that's a pretty strong statement. And there was a study that was published in the Journal of Health Economics. So it's called The Value of Disease Prevention versus Treatment. And it found that the demand value of prevention always exceeds that of treatment. So disease prevention is the process by which actions can be taken to reduce risk factors known to lead to specific conditions. So this is what we're looking at, right? And millions of individuals die each year from really preventable conditions, and these are including heart disease, cancers, chronic respiratory disease, stroke, and diabetes. I mean, these are all things that can actually be prevented if one is willing to do what they need to do in order to prevent it, and so that's really what we're focusing on, right? Is to try to prevent disease from happening and from developing. So, what does the research have to say then? Well, there is one research from the Archives of Internal Medicine, right? It reports significant results for, participants following a combination of 4 different lifestyle changes. And this study followed 23,000 participants. So, and it adhered to about 4 different behaviors, right? And so it's non-smoking, exercising 3.5 hours a week, eating a healthy diet, and maintaining a healthy weight. These behaviors alone, attributed to 93% of diabetes prevention, right? 81% heart attack prevention, 50% stroke prevention, and 36% cancer prevention. Can you imagine if we were able to um, get these millions of people that were dying each year to follow just some of these basic four plans? We could prevent a lot of disease from happening. Um, Another study published in The Lancet actually followed 30,000 participants across 52 different countries. So similar results were reported with a 90% prevention rate of all heart disease with lifestyle changes, right? You're not, no medication, uh, no drugs of any kind. It's just using lifestyle changes. So you can do 90% of this work with just making these simple lifestyle changes. And note that these are just two examples of the ever growing body of research on lifestyle changes and disease prevention. I mean, pretty powerful if you really think about it. 90% prevention rate is just amazing. So, there's many factors that contribute to heart disease. So we need to talk about heart disease because this is a huge one. While genetics contribute some degree, many other factors are within our control. So, according to Dr. Hyman from the uh, part of the Institute for Functional Medicine, is also part of the Cleveland Clinic. Uh, you know, the quote is genetics loads the gun, but environment pulls the trigger, which essentially means, yeah, our genetics are handing us certain guns. It may hand us the heart disease gun. It may hand us the diabetes gun. It may hand us a thyroid gun. But essentially, unless you pull the trigger, which triggers are all over the place, right? Environment, food, stress, all of these types of things. That's what's going to actually push it over the edge to where it becomes an active problem. So aspects such as high blood pressure, high blood sugar, or abnormal cholesterol are really the contributing factors to heart disease. And these are often treated with medication. However, Hyman reports that studies have increasingly shown that treating these risk factors has only little benefit or none at all. Lifestyle changes are the most effective tool for preventing contributing factors, thus significantly reducing the risk of heart disease. A note on medications. While medications certainly have a place, um, a study in the Nutrition Journal compared treatment with statin drugs to a diet rich in like fiber, almonds, and plant sterols for the lowering of cholesterol. And you know that amazingly, the study found similar rates of cholesterol reduction. However, the dietary changes also reduced inflammation and homocysteine levels. Now, homocysteine levels are basically a marker for inflammation. When you get your blood tests, that's one of the markers for inflammation or systemic inflammation. So, not only did the diet really do exactly what the statin drugs did, it also lowered the inflammation systemically in the body, which the statin drugs were unable to do. Not to mention the horrible side effects of statin drugs to begin with. So simple diet modifications. Functional medicine really utilizes the following modifications for preventing and reversing heart disease in some cases. Eat your phytonutrients. Try getting 8 to 10 servings of colorful fruits and vegetables to maximize this disease-fighting benefits of these vitamins, minerals, fiber, antioxidants, and anti-inflammatory molecules. I mean, this is super important, and everybody knows we need to eat more vegetables. You could ask anybody on the street, hey, what do you need to eat more of to be healthy? Somebody's going to say vegetables, right? Stabilize the blood sugar by incorporating small amounts of protein, healthy fat, and healthy carbohydrates at every single meal. Get more fiber. The average American adult is really only getting, and this is amazing, 15 grams of fiber per day. Work your way up to 50 grams if you can by incorporating these high fiber foods like vegetables, nuts, seeds, whole grains. And if you ever wonder why processed foods have such a long shelf life? Well, processed foods are packed with all sorts of chemicals and dyes and are lacking these essential nutrients. So you buy these packaged foods, you're not getting what you need. You need to be eating these fresh foods, right, that have the nutrients that you need. Eliminate foods with hydrogenated fat, such as margarine, shortening, processing oils or processed oils, and many baked goods and processed foods. These are like cookies and crackers. Instead, opt for foods with healthy omega-3 fatty acids. This is going to benefit you immensely. All right. Now, what about anxiety in the gut? I mean, we got to talk about those, right? Anxiety is a normal part of life. Everybody has it. However, when anxiety doesn't go away, it can interfere with even the smallest things in our daily life, right? Conventional medicine approaches anxiety by balancing neurotransmitters in the brain, right? By medications. Functional medicine takes a look at the root causes of anxiety. So, let's discuss a little bit about gut pathology. Let me bore you a little bit here. And how gut pathology contributes to anxiety. Instead of suppressing symptoms through prescription medication, functional medicine examines the underlying cause. So even if anxiety is caused by an imbalance in neurotransmitter activity, what is the cause of the neurotransmitter dysfunction? You're never going to solve the problem until you know what the cause of that dysfunction is. A functional medicine doctor may start by examining your gut health. The body of evidence links the gut health and brain health linking gut health and brain health has skyrocketed. In fact, research on this link goes way back to even the early 1920s. Gut inflammation, small intestinal bacterial overgrowth, also known as SIBO, if you've ever seen that, SIBO, and fungal overgrowth affects the brain. Additionally, serotonin, a key neurotransmitter, is produced in much higher volume in the gut than the brain. Some doctors even argue that the gut is our second brain. There is an actual book, and I wish I had it on me, but it's called The Second Brain, and it explains that we have millions of serotonin receptors in our gut, right? So you can imagine if we eat a certain food, it can actually disrupt those serotonin receptors and can essentially affect our mood and affect our depressive state. It is recognized that the dysfunction in the gut can lead to a variety of cognitive, mood, and behavioral disorders, including depression. So amazing how taking care of our gut can actually take care of so many other things that we didn't even think about. I mean, who would connect the brain to the gut? Nutrient deficiencies in mental health. We got to talk about that, right? The link between nutrient deficiencies and disease cannot be overlooked at all. Your functional medicine doctor will most likely want lab work on your blood and urine nutrients to determine if any are low, right? Some of the most important ones that we talk about a lot are B12, folate, zinc, copper, EPA, DHA, vitamin D, and B6, and even riboflavin, right? These all play an important role in mental health and neurotransmitter activity. Shellfish and organ meats are the highest in many of these nutrients listed. Not that that's all you should be eating, but those are some of the foods that are actually very high in helping our neurotransmitter activity. What about skin conditions? Because we do really have to talk about that. I mean, I've seen just an immense increase in skin conditions, and so one of the things that we need to talk about is cortisol. Right? Cortisol is noted as it's a very potent stress hormone, and has been associated as really a major contributor to a number of chronic conditions. Well, while cortisol plays an essential role in circulatory function, excess levels can really be deadly. Many studies have examined really the relationship between stress and health, and the results are seriously really alarming. So well-documented negative health results of stress include really damage to your immune system, so we wonder why we're getting sick all the time. an increased risk of diabetes and obesity. That's definitely not a good thing. Poor cognitive function and focus. These are things that these are just a few of what can be affected. Our skin is really the largest and most visible organ of the body, and most people don't know that the skin is an organ. And did you know that your skin can really reflect deeper issues of health? One of the most common chronic skin conditions is eczema, an inflammatory skin disorder and it really results in, you'll see like red, dry, and itchy skin, right? And a lot of people call it dermatitis, um, um, and similar symptoms like that. Excuse me. Uh, you know, Antibiotics are commonly used to treat infections, right? I mean, I think we're over, ingesting antibiotics in this country, unfortunately, which can be very detrimental to our system. And we treat infections with it. However, they can really weaken the immune system, and they can lead to a number of chronic conditions when inappropriately used, which I believe we're doing now. Thus treating skin conditions from the inside out is necessary to address the root problem, right? But if we talk about antibiotics, I mean, when your kid gets sick, what do you do? You go to the doctor. Does it matter if it's a flu or a bacteria? No, they're going to give you an antibiotic, just to cover the basis. They don't determine whether it's bacterial or virus. And a lot of these antibiotics, they don't work if it's a virus. So just another understanding of the differences between functional medicine and conventional medicine. Functional medicine treatments. Let's talk about what could we do for skin conditions. What can we do from the inside? Well, a few examples like tea tree oil, coconut oil. These are very potent antifungal agents. And these can be applied to infected skin after showering. You can even ingest them, right, which is a good antibiotic type of thing within your body. Witch hazel, chamomile, these are also great anti-inflammatories to apply to like acne spots or those rashes that we were talking about. Apple cider vinegar, this is ideal for treating fungal infections as well. Now, if poor nutrition is thought to kind of be the culprit, we got to switch gears a little bit. Ruling out common food allergies, right? There's a big increase in gluten allergies these days, and that's a whole nother lecture that we would have to go over to discuss the gluten allergies and why that's the case. And let's talk about increasing your intake of anti-inflammatories. Foods are definitely going to help, which are high in vitamin C, bioflavonoids, iron, carotenoids, and vitamin E. Those are just some examples of anti-inflammatory foods or nutrients in anti-inflammatory foods. Staying hydrated with water. Avoid these processed foods that are also high in sugar, which we talked about earlier. Functional medicine can help through various outlets. First and foremost by addressing the underlying cause of stress. Diet, exercise, relaxation techniques. These are also will be employed as well with your functional medicine practitioner. Now, here's the big one, right? Especially if you are here and live in the United States, you know that stress management is very difficult to do because either we live in traffic, and we're in traffic every day going to work. We work with people that are very highly stressed already, so that stress trickles down to us, and whether it be friends, family, bosses, whatever the case may be, everybody deals with stress. And really cortisol is noted as a potent stress hormone, right? And when we're in very high stressful situations, our cortisol levels jump up, right? And as we talked about before, this can be very damaging to our immune system, and it can increase lots of different disease risks, as we said before, like diabetes and obesity. And also it can contribute very highly to poor cognitive function and focus. So stress management is really an important part of functional medicine. that really we discuss with every patient that comes in, and how we can help that. Also, detoxification. I mean, if you got stuff in your body that needs to come out, we got to get it out, right? And the body already has a number of detoxing methods, but through functional medicine, you can aid this natural detoxification process the right way, right? So we talk about the liver; that's the main detoxing organ, and when the system becomes overloaded with toxic agents, they can accumulate and get trapped in the body, right? And this can be various different things that we go through, what we use as far as our shampoos, our soaps, our cleaning fluids, um, makeups, obviously what we put in our body. But the purpose of the detox program is to reduce the burden of being overactive from the liver and digestive system, right? By allowing it time, anywhere from a week to a month, uh, to rest, so it can once again function optimally. Additionally, it's also important to support the detoxification pathways with the proper and necessary vitamins, minerals, and micronutrients, right? And that's all what your functional medicine practitioner, or if we ever get the chance to work together, what I would do for you as well. And we'll determine, those types of things for you. We got to talk about supplementation, right? Because this is important too. You have to be able to give your body the nutrients it needs. Many patients wonder if they can get all the nutrients needed from the diet alone. No. Ideally, food would be everything we need. It would provide everything. But however, there's several factors causing the diet alone to not be enough. For example, depleted storage, depleted soils, sorry. Um, the storage and transportation of food, the genetic alterations, they all impact nutrient content of everything we eat. You're supposed to let land sit after you harvest it, but we don't do that. We replant right in the same section, right? So you don't get the nutrients, the minerals, and everything else coming back into the soil to be transferred into the things that we eat. So that's one problem. Examples of some of the conditions requiring additional supplementation include obesity, diabetes. These are a couple of the major ones. Both conditions are a result of malnutrition. Now, essential vitamins and minerals are needed to restore balance in the body's functions. So this is also something that your functional medicine practitioner will develop for you based on your personalized program, right? So not everybody gets the same thing. And we'll discuss that, obviously. Depending on your current state of health and healthcare goals, supplementation programs will differ, like I just said. And this is kind of the wonderful, exciting thing about functional medicine is there's not a one-size-fits-all approach. Every level of care is developed specifically for you and with you, right? So this is a team effort like what we talked about before. So, what can we expect? What can we expect when we see a functional medicine doctor? Well, when visiting one, you can expect your visit to take a bit more time than it would with a conventional practitioner because we need to find out more about you, not just the symptom that you're having. Functional medicine practitioners are looking for an in-depth information, right? Your personal family history, the circumstances around your first symptoms, as the goal is to uncover the underlying cause of your health problems. A detailed history, physical examination, laboratory testing, whatever's necessary to see the full picture. Now, this may seem like an initial investment, but it is worth the time to get to the cause rather than treating the symptoms, which can lead to recurrent problems and even more serious problems. The Institute for Functional Medicine, they suggest a list of questions to ask practitioners to get the most out of your experience, right? And so there's a lot of questions being asked. So how, things that you could ask your practitioner. So how would you describe your practice? Do you work with other clinicians, nutritional professionals, health coaches? Do you have information you could send me about your practice? Do you have experience treating my conditions? What are the main therapies that you use? things like dietary, chiropractic adjustments, supplements, prescription medications, are they typically covered by insurance? So, these are all important questions, right, that you need to understand before you decide to dive in um, into working with a functional medicine practitioner. You want to make sure that they have the tools necessary to take care of you and the right tools. And so these questions are very important to ask uh, uh, your your practitioner when you see them. Here's just some references. Obviously, there's a ton of references that we go over and with various um, different people and organizations, and everything really is. You're seeing a pattern these days that, like we talked about before, um, the uh, the patterns of being able to uh, make just those simple changes. You remember those 4 changes that we were talking about at the very beginning of our time together, making that can really decrease so many diseases by even 90%, which is incredible. Um, but one of the problems that we face is most people don't know where to go. They don't know what to do. They don't know what changes to make. And really, that's where someone like myself comes in, that can direct you, that can help you, that can coach you, that can take you where you need to be, and help you understand exactly what it is you need to do to get back to optimal health. Okay. I want to thank you, obviously, for joining me. Um, you know, we hope this has provided you with just some useful information, and that you feel ready to schedule an appointment with either me or another functional medicine practitioner. Um, I will definitely put my information. If you look up at the top of the little screen here, there'll be a contact bar there that you can click on. Send me a little message, your name. I'll be happy to even just hop on the phone with you and talk for a little bit, but just to schedule an appointment with you so that we can get to the root of what's going on, and how by using functional medicine, we can really help you gain optimal health. Again, I just want to thank you so much for coming, and just for allowing me to uh, really talk to you about these most important things. So I hope to see you soon. I hope to hear from you soon. And yeah, um, have a great day.